Now let's get a fuller perspective on Gombe State's Go Health now. And joining us for this conversation is the Commissioner for Health in Gombe State, Dr. Habu Dahiru. Good afternoon and welcome to the program.
Thank you very much. Good afternoon.
Yes, let's start by asking you to elaborate on the state's efforts to ensure free health care for the people and indeed the cardinal objectives of Gombe State's Go Health scheme.
Well, the main objective of the scheme is to provide health care to everyone. For us to achieve universal health coverage, I think this is the way. Health financing has always been challenging, and when we discovered that establishing Gombe contributory scheme will give us the opportunity to for everyone in Gombe to have access. We started with the formal sector, meaning all the civil servants. We dialogue with the labor, and they all keyed in. And later on, we went into the local government. Now the teachers from the local government, we also dialogue with the Nigerian Union of Teachers, and we convinced them the importance of registering under the scheme and the benefits on them and their families. Today, we're able to enroll all the civil servants in Gombe State, both in the state and the local government. We also started the enrollment of the informal sector. We've done sensitization to also enroll tertiary education program for students at the tertiary institutions and also pensioners. But this is we've now done the stakeholder engagement and we've sensitized them. We're now starting registration. You recall that the Basic Healthcare Provision Fund takes care of the under the equity takes care of the poorest of the poor. So in that regard, a vulnerability index curve was made. And we got very vulnerable, very poor, cannot afford. So we have registered them in very large numbers across all the LGS. What is so this in Gombe is you can register in the comfort of your room using a handset and in local language or in English. So registration becomes a lot easier. People don't need to travel to the headquarters in order to register. Again, we also established call centers in all the 11 local governments. And we provided logistics for them, and they're on solar to ensure that power is constant and everything is digitalized. And it's make work very easy. The contentment from the patients. With the Go Health, we also established the Gombe Drug Management Agency, where affordable drugs are there. Now, it's one thing for you to come to the hospital and get consultation under the Go Health program, and it's another to get reliable drugs that are affordable. So the two programs made Gombe stand tall. And that's why probably His Excellency was also rewarded in this regard that Gombe State came high in provision of health care to the people.
Yes, and from your explanation. Yeah, you land on that thought there now so that I can come in. You can land on that thought so that I can come in.
Okay. What I was saying is with the establishment of Gombe Contributory Scheme and the Drug Management Agency that ensured regular, sustained drug supply in the facilities. Now, when you Go Health register you and you have access to every facility at any time, 24/7, and especially women and children. These are the large numbers that come to the hospital. And on the program, when you register as a household, the husband and the wife and the 4 kids are registered, and they have access to healthcare from consultation to laboratory services to surgery and also medications.
Indeed. And from your explanation, it appears as if the scheme has covered all age groups and categories. So what are the numbers?
Absolutely.
What are the numbers now that you've been able to secure registration for across these age groups? And considering that there's a whole gamut of healthcare, from tests to consultancy to, treatment and drugs that you talked about, what is the value that they contribute? And beyond the basic health care, what about, complexities in health care? What intervention does the state government offer beyond, an individual that is requiring basic health care that now requires treatment for maybe terminal conditions? So 2 questions there.
Yes.
The numbers that you have covered
with that,
and the value.
having registered, we first of all, before we even establish Go Health, we ensure that all the facilities are ready to provide service. Meaning we upgraded all the 114, at least 114 PHCs, meaning every ward in the local government have upgraded primary health care center. Then the secondary facilities, we upgraded the general hospitals and the cottage hospitals. Then in the human resource for health, we also recruited more hands because under this program, every primary health care center must have minimum a midwife and other laboratory staff for them to work efficiently to cater for antenatal service and hospital delivery, which is one of the major things. As you know, in Nigeria, or in particular in Gombe, the maternal mortality was high. So how do we contain it? Is to provide adequate prenatal, antenatal, and postnatal care. And through that, midwives are very key. Then the medical officers and other staff required. And that is why we rejig the human resource in health in Gombe. And then we provided the registration and ensured that infrastructure-wise and equipment were procured to, we improved the infrastructure, we procured additional equipment to ensure that services are rendered without any hindrance.
There's more to touch, but would like to thank you very much, Dr. Habu Dahiru, the Commissioner for Health in Gombe State. Thank you very much for your time.